Hi, everyone. Thank you so much for joining us today. I know that for many of us, this is an uncertain time. It's an overwhelming moment, especially if you are in the middle of treatment or you're trying to make decisions about what to do next. So, the intention here is to create a space where you can get clear, reliable information and feel supported while you're navigating this moment. I'm Cassie Destino. I work with Orchid doing patient support and community outreach. And today I'm hosting our chat with Dr. Partha and Anne-Sophie. So we're going to speak about the medical side of things, the emotional and psychological impact of this moment. We're covering some key concerns that have been coming up in the community, including what happens if a cycle is disrupted and how to think about timing and decision making and how to manage the stress and uncertainty that many of us are feeling. We're also going to leave some space for your questions. If you've got them, you can pop them in the chat. So if you're feeling a bit anxious or uncertain or just looking for some clarity, you're in the right place. We don't maybe have all of the answers, but we're here to help you feel a bit more informed and steady with what comes next. So let's begin. Dr. Partha, I'd like to start with you. From a clinical, practical side, if a cycle is interrupted mid-stimulation due to external factors, what are some of the realistic options? Continuing, converting a cycle, canceling a cycle. How do we navigate some of these decisions, and what do we think the outcomes could be expected? Dr. Partha, you are on mute.
So sorry. I'm so sorry. I hope I'm audible now.
Yes,
So
you are.
thank you so much, Cassie and team, to organize this session. It is very important to tell the community of what we are doing in this moment of global crisis. So as we all do understand that fertility treatment, including IVF or artificial insemination or transfers, embryo transfers, this is a very elective treatment. That means we decide what we want. We plan beforehand the way we would like to organize the treatment protocol. Now, keeping in mind the situation that we are in now, which is a global crisis, situations which is not being stable in the country, the question is, can we do our treatments, our fertility treatments? Can we call our patients in to start the treatment? As of now, yes, we can do that, and we are doing it. And so far, things have been going very good. But with always a point and a note and a counsel to the patients and the couple that so far we will do the same practice that we have been doing all the while that we have been doing. And in case there is a kind of a decision from the government that we are not supposed to come to the clinic, or you as a patient, you're not supposed to visit the clinic, then we would stand to cancel the cycle. And we will be talking to you beforehand to you, and will be guiding you accordingly. Now the question is, if I stop my injections in the mid-cycle, will it hamper my hormones? Will it cause any kind of disruptions to my cycle? No, it will not cause the disruptions to your cycle. These are just the basic varied hormones that you already have in your body. We give a little bit more in the form of injections, just to get a good follicular count. If you stop in between, nothing will happen. These follicles will again regress in size. You will again get your period. Maybe we can give you a little bit of progesterone so that you get your cycle in time. And once the situation becomes better, we can restart the whole process. So will it cause any harm to you? Absolutely not. Will it be okay to restart again in the subsequent cycle? Yes, absolutely. When the situation is under control and you are able to visit the clinic, you can again restart the process.
Are there specific points in the cycle that are more vulnerable to disruption than others? If you had to stop for a few days, is it possible to pick back up again, or is there a certain part of the cycle where if you stop, really the cycle has to be canceled?
No, no, it's not like that. The initial phase of the cycle cancellation should not be a problem at all. But just imagine a situation where we have done the stimulation for 12 to 14 days, and the patient has taken her injections, and she's due for an egg collection after 36 hours. And just on the night before, suppose if you get an alert saying that you cannot step out of your house and we cannot come to the clinic and the clinic stays closed, that becomes a little, uncomfortable situation for the patient that, oh, I was supposed to go for my collection tomorrow morning and I'm not able to go. And with this follicles being loaded out there in the ovaries, but nothing will happen. We can give you some confidence and again, you will get your period in no time. So the earlier you can cancel, much better because you have not exposed yourself to so many hormones. And later, after the trigger injections, it is just a feeling of discomfort because you have already done stress stimulation, but again, there is no harm. So again, as I said, fertility treatment and stimulation is very safe. We can start and we can continue, or we can stop.
I mean, that was one of the questions I had was, is there a point where you would advise pausing rather than proceeding? So you're saying in the first part of the cycle, it should be okay to pause.
We can pause anytime. Our main aim, see the intention. Our intention is to help our couples and the patients in the community to help them finish their fertility treatment as soon as possible. So if we want to understand this a little better, we have been victims of two big calamities, in the past few years. One was the COVID 4 or 5 years back, and now it is the situation out here. That was more difficult in COVID times because, human to human, face to face interaction was quite difficult because we were scared that one person is giving the virus to the another person. But this is not the situation here right now. The only problem right now is that can I come out of my house to the clinic and go back safe to my home? That is the only problem. So as of now, yes, because of the country we stay in, it's absolutely safe here. We are able to do that. We can start the stimulation, we can continue. And so far, we have been doing this to all our couples and our patients. We are telling them that we can start safely. There is no problem at all. We can retrieve your eggs, make your embryos and freeze it. But we will not be in a haste to transfer these embryos, So can we safely go ahead and do an IVF and freeze your embryos? Yes. Can you come and do a transfer? That we need to discuss a little bit more in detail because transfer is not only a procedure that we have to understand. Transfer is aiming to get you pregnant. And what happens if you get pregnant? The prenatal care and that 9 months follow-up. And in this moment of uncertainty, will you be able to, go to the hospital to take care of your antenatal checkups and medications? That we have to understand. Maybe we might give a little pause to those transfers right now so that you don't get pregnant in these uncertain situations. But yes, egg retrievals and freezing your eggs and embryos, we can do that.
One question that's come up a couple of times actually is, does the clinic have a contingency plan in place for these sudden disruptions in terms of staffing and lab access and medication supply and safety of frozen embryos? Can you talk a little bit about that side of things?
We do have contingency plan, that is a part of our the very fact that we are a tertiary care fertility center. So we do have a brilliant contingency plan, and it's a standard operating procedure here, which we follow very rigorously. And when it comes to staffing, we have to understand that the very fact that as doctors we are coming to the clinic, you as patients, you are coming to the clinic to seek the fertility treatment. So likewise, we have our staffing, which includes our nursing staff, embryologist staff, are also coming and attending to the clinic. So we have a discussion with all our staff members, like, which part of the town you stay, which is the vulnerable zone, where are you able to come in a safe sound manner. And if we feel that a particular staff has got an issue, we always, give them the advantage of staying at home, and, asking the other people to come in and attend the duties. So that is about the staffing. So till the time we say that our clinic is open, yes, doctors, our nurses, our embryology team, and the allied supporting staff, we all are in the clinic, including the receptionists, the call centers, the administrative staff. Everybody is in the clinic to support our clients. This is one thing. Second thing is about the contingency plan of the backup of our embryology lab in case of uninterrupted, like, the power supply disruptions. Now, we do have all these backups in place. We do have a contingency plan, with other clinics, where we can, end up with hurting ourselves as a clinic. We can shift our embryos to another center and all this. We have all this.
So there's some overlap in terms of safety, in terms of keeping these precious embryos that have been created safe for future use. That's very comforting to know. Finally, for now, I have a specific question about a woman who had an endometrial scratch last week. And she's wondering how long is the benefit window of something like that. If she has to delay her frozen embryo transfer, does that advantage disappear?
So it's not only about the situation that we are in right now. It is a general counseling that we do for all our patients that once you have done any kind of invasive procedures, like it could be a diagnostic hysteroscopy or an office hysteroscopy or an endometrial scratch, the benefits stay for 2 to 3 months. Right. So we would advise that if you have done hysteroscopy now, then within the next 2 to 3, 4 months, you finish your transfer so that you get the benefit of the procedure that you have done. So yes, if somebody has done the patch procedure in a week's time, so ideally in the next 2 to 3 months, you should to avail that.
That's comforting. Anne-Sophie, let's talk a little bit about some of the emotional and psychological impacts of this moment.
Yeah.
How do you manage ongoing uncertainty without it taking over your daily life?
I think uncertainty is the hardest part of all this situation because it's the most disturbing. If someone will tell you, okay, this gonna end on next Friday, you will be able to adjust to have a certain agentivity around that timing. But as uncertainty is there, it's really disturbing. And unfortunately, we can't erase this uncertainty. Like, we can't erase it. We will have to grow our tolerance to the uncertainty and go back to something that is in our control, like daily routine, simple things, grounding, like, being there, being in the present moment instead of wandering and your mind imagining 1,000 scenarios, being there, being present. And I think there is a lot of question I will answer about grounding, breathing techniques, and techniques to help you ground and be there right now.
Well, let's talk about that. So
Yeah.
for patients who are feeling constantly on edge,
Yeah.
what techniques are actually effective in bringing that sort of baseline anxiety down a little bit?
Yeah, I would like first to talk to you about the nervous system. I am sure you know about it, but I think it's important introduction. Like the nervous system has a built-in survival response, as you know, which is fight or flight or freeze, which is when your mind is perceiving a threat. And I like the fact that it's perceived threat, like even if I think you experienced it, like when the war began, maybe you were like, okay, I don't know, the threat is uncertain, and your body and mind was not perceiving the threat as big. But when something fall into a tower in a residential area, you felt like the threat was really, really close and big. And so, yeah, the mind reacts to a perceived threat and fight and flight or freeze. Fight, you will find anger, you will feel, angry, you will feel a tension in your body. Flight, you will find a urge to live, like anxiety. And freeze, you will just feel numb and without anything feeling. This is an automatic response. We can't really, like, it's an automatic response, so we can really have an impact on how we will react. But what we can do is regulate afterward. Like, first response will be fight or flight or freeze, and then we can regulate by grounding techniques, by breathing, to send the message back to our mind and body that, okay, we are safe right now in this moment, in this particular situation. Sorry, this was the introduction. And techniques that are efficient, I will start with breathing techniques, which is really simple but really, really efficient. By adopting a breathing, like a relaxing breathing, which is a belly breathing, like you are breathing from your belly, like when you inhale, your belly has to inflate. And when you exhale, your belly has to go back flat. This is the belly breathing, and this is the breathing you adopt when you are about to fall asleep. So by forcing this breathing, you are telling your mind and body that, okay, I am safe, I am in a relaxing time. When you are in distress, the breathing is from here, like, and we want to avoid that because this is a reaction when you are in stress, when you are in this fight and flight mode, like breathing became shallow, you are out of breath. And consciously, we have to come back to this belly breathing. There exists a lot of belly breathing, but one which is really effective to calm yourself is called 4-2-6. You inhale on 4 counts, then you hold your breath for 2, and then you exhale for 6. Which is what is effective is that the exhale is much longer than the inhale. This is the most relaxing breathing, but if you don't want to count your breathing, you can just take 3 deep breathing, and it's really effective, like 3 deep breathing just to pause, to come back to your body and to tell your nervous system that, okay, I'm safe. You can even say it in your head or out loud, like, I'm safe in this moment, in this space. So this is the first technique, really, really useful. There is a lot. Grounding techniques is used to come back to your body and not being just in your mind, in your head, spiraling on anxiety. So grounding, usually feature sensory activity. So grounding, you can stand and really notice how your feet are on the floor. What is the texture of the floor? Is it cold? Is it hot? How is it hard? Like, okay. And from there, imagining roots from your body to the floor to really anchor yourself on the ground. And same with the breathing and with in your mind saying, I'm safe, I'm right there right now. And it feels really simple and a bit silly, but I can assure you, I promise it's working. It's working because right now you're in your body, you're in the present moment and not spiraling around future, what's going to happen, is it safe or not? Like you're just there and it's really helping calm your nervous system down.
That is so helpful. That is something
Sorry.
that there's so many applications for that in life. Those
Yes.
are really, really
Oh,
useful.
yeah, no, definitely. You can use
Yeah.
that every time.
Yeah. How can we identify when a patient's anxiety has moved beyond expected levels of stress and might benefit from additional psychological support?
Yeah. Right now, the situation is distressing. So if you feel anxious, if you feel tired, if you feel a bit helpless, all of that can be normal. I would say, like every disorder, we will know by intensity, by frequency, and if it takes really a lot of space in your day, this can be a disorder. But I would say don't wait. Like if you feel that you are really in distress, if you feel that you are unable to cope, that it's difficult to regulate yourself, just check with a therapist, a psychologist, just have one session and see if it's something you can fix with some techniques, or if you need more help around this situation. You don't need to have a disorder to seek support. I always say that, rather sooner than later.
Yeah, yeah. Um, let's talk a little bit about social media.
Yeah.
I think setting boundaries around social media and news and just these outside inputs, I think many of us are experiencing being checked in on by people we haven't spoken to in years, and
Yeah.
there's an expectation of anxiety when someone's saying, oh my goodness, how are you, we're so worried about you, I'm so
Mhm.
scared for you, when
Yeah.
you maybe are feeling kind of okay, but you keep getting this outside signal of you should be stressed.
Yeah. Mhm.
How do we set some of these boundaries around what we allow in?
Yeah. I think it's two different things. Like people worried for you, people wanting to have some news. You can, if you are willing to do that, you can communicate like, okay, I'm not that stressed. My anxiety level is not that low. Like, please refrain to pass that on to me. Or you can create a WhatsApp group when you post one message, and then everybody is just informed about your mental health. For the news, it's different because, of course, you want to have some news, you want to be updated, and it's scary. So it's more about structuring that boundaries. You can for the news, you can have a limited time when you know you will check the news. Like, for example, okay, I will check for 5 minutes, 10 minutes, if it's what you need, but not being caught up the news and the anxiety building. Of course, avoiding to read the news first thing in the morning and before sleep. Even if it's the time we have the phone close to our hands and we need to know, it can disturb the sleep and raise anxiety, especially at night. And also, what would I had? Yeah, notice how you're feeling. Like, of course, you have to check the news, but notice how you feel. Like, what's the emotional response from reading the news? And then maybe set your boundaries accordingly. I would say that.
So,
And of course, the grounding techniques and the breathing techniques, and I have all other grounding technique I will tell you after that. But of course, it's also helpful while reading the news. Like, being mindful of, okay, I'm reading the news, anxiety is raging, but right now, nothing has changed. I'm still in the place I am. I'm still safe. To get back to your body and notice what's happening inside you.
so actually, that a question for both Dr. Partha and yourself. Maybe Partha, you can start. People are always very concerned about stress and IVF outcomes. Can you talk a little bit about, are there some misconceptions about stress and IVF outcomes?
So, I know the situation that we are in right now is very, like, nobody knows. You, me, the patients, everybody, we don't know what's going to happen tomorrow or the next second or the next week. When we are sitting and talking to our patients, and behind the windows, you suddenly hear a big thud, and, we all get support and confidence, and we learn a lot from each other. And me as a physician, when I'm sitting with my patients, trust me, the whole month of March, and I have been talking to them, and I have seen a big host of confident patients and the couples that we are seeing in the clinic. Everybody is so focused, everybody is so confident, everybody is so secure. They know that they are in the safe place. They say that, doc, don't worry about it. We are all in it together. I'm sure it'll all pass. And that is the confidence that we have to share with each other. That is the positive energy that translates from one cell to the other and one human being to the other. With that note, what I want to say is that whole process of fertility, forget these difficult times, but the very fact that somebody is coming to a fertility center to do an IVF program is for the couple, right? Because we are dealing with the situations of what if this doesn't work, and we start this counseling session right from the first day we see the first consultation. We are, I would say, less of a IVF doctor and more of counselors. I mean, Anne-Sophie, you have a challenge from us. So we talk a lot with our patients. We counsel them a lot. We talk to them about the positive outcomes, the negative outcomes, and it is not only about trying to. Of course, we all are trying to achieve a positive outcome, but also we have a chat about how do we deal with the negative situations. How do we manage our expectations when we encounter negative outcomes? And to top it all, right now, in this uncertain situations, how do we cope up with that stress and anxiety? And as Anne-Sophie has mentioned it very, very clearly, there are coping strategies. But I think discussion, talking really, really helps with each other.
Yeah.
You just have to follow the directives because it is not in your hands. It is not in my hands. It is somewhere else, right? So we just have to be patient. We just have to be compliant with the process that we follow day in, day out, and just ensure that overall, when the patient comes to the clinic, we are taking care of every bit of their, sessions of the care that we do with our patients, which means that talking to them, and in case we feel that our couples and patients are a little bit I think a little over the edge. We always ask them to see our counselor, who can do a little bit of more talks, with them and try to adjust this whole situation. Yes, that is how we manage the stress situation at this point in time.
But physically, medically speaking, if somebody is feeling a great amount of stress during this experience, if they are having these kind of spikes of anxiety, do they need to be concerned that this anxiety itself is interrupting or interfering with their fertility treatment? There is a conception that if you're stressed, your hormones are off and the meds won't work and you won't get the eggs and your follicles won't grow. Can stress truly, this kind of acute stress, can it truly disrupt your IVF cycle once you are already seeking treatment?
Yeah.
What? Sorry.
Brilliant question.
Yeah.
A very, very important question. And that is what I had told you before. When we are talking, as of now, in this situation, when we patients are coming to us saying, the doctor, we would like to start this program of IVF or whatever. First of all, neutral talk starts from my side. Like, we are in this situation now. This is the way we will proceed. And as we are talking, we are able to see how the couple or the patient is responding. And if you feel that the couple is literally over the edge and very, very, with panic attacks and anxiety attacks, I would probably discourage them to proceed, continue with the fertility treatment, because this negative effects creates a lot of inflammation in the body, and that is probably going to disrupt the IVF. And IVF is a very, very niche procedure, where everybody is, putting a lot of effort, into it, and we want it to succeed. So if you find that the patient is really, really having anxiety attacks, panic attacks about the outcome, I would probably ask them to take a step back, visit a therapist, have a chat session, try to overcome this. And by this time, we buy time, the situation of the country might be much better. And then we start the process, because delaying the process by a month or two will do no harm to the fertility outcome, but it will do a lot of benefit to the psychological well-being of the patient.
That's comforting. We have gotten through most of our questions. I just wanted to say to the people who are joining us, if you have a question and you would like to ask it, you can either put it in the chat and I can ask it for you, or if you'd like to unmute yourself and ask the question yourself, you're welcome to do that. If anybody wants to do that, if we haven't covered your question, this is your opportunity to ask it. Maybe I'll let people sort of think about that. And Anne-Sophie, in the meantime, one more thing I wanted to ask you about, pardon me, is how can couples be supporting each other during this? This is something that they're both going through and they're experiencing it at the same time. What are some things that they can do to support each other?
It will be very cliche again, but communication. Like, each person has different way of coping with stress, coping with this uncertainty and with this distressing and exceptional situation. So just be gentle with yourself and with your partner and communicate clearly. Like, okay, my needs right now are this and that. And your partner will say also, my needs are this and that, and understanding each other and trying to find comfort in each other by communicating clearly and avoiding, misunderstanding and expecting something from the other. I think in this time of distress, we have to be clear about what we need and what we can give also to the other person. I would like to add something, if it's possible. It's a technique that I think may be containing everything, which is called dropping an anchor. And the little story about it is like imagining a boat going back to the harbor, and there is a storm happening. The storm is the exceptional situation around us. So the storm is happening, and what the boat can do, like to not be turned and just churned by the storm, it can drop an anchor. And by dropping an anchor, the boat will stay there, safe at the same place, while the storm is doing its thing, and then go back to normal, and the boat will be there. So how we can drop an anchor for ourselves emotionally when things around us feel like a storm, and that we want to stay safe until the end of the storm. Drop an anchor by ACE. Acknowledging what is happening around inside us. Thoughts, emotions, feelings, in our body what's happening. C, coming back to our body, like moving. If you are seated, just press your feet on the floor and jiggle your toes, like do that, stretch your hand, your shoulders, stand up, like, but come back to your body, move your body, do something with it. And then E, engage with the world around you. So you can go into an activity, you can do something with your hands, kneading, making some bread, doing something that engage with the world, engaging in social interaction with someone around you, like, but ACE can really, really help you go out of an emotional, overwhelming, and yeah, I think it's really important.
Right, excellent. Did anybody else have any questions that they wanted to share or ask at this point in the call before we wrap up? All right. Well, I do want to thank you so much for being here today. A lot of you sent in questions, and I think we covered them. And I really do appreciate your openness in sharing your questions and your concerns. I know that this is not an easy time. Many of you are having to make decisions without the level of certainty that you would normally want to have. So hopefully today has given you a bit clearer of an understanding of your options and a steadier way to approach what's next. A big thank you, Partha, for your time this morning. Do you have any final thoughts for us, Dr. Partha, as we wrap up today?
Yeah, thank you so much, Cassie. I just like to put forward the point that I know these are difficult situations, and I know that the situations that we have experienced before has made us more strong in how we perceive things. And staying in a country like United Arab Emirates, we know that we are secure and safe. Pertaining to medical treatment, specifically fertility treatment, we are every day coming to the clinic, our full staff, and doing the procedures and cases like the way we have been doing since beginning. Our utmost care and support is there from the whole team, ensuring that we do the things, the clinical practice, following the directives of the government. When we start your program, your fertility treatment, we are always talking to you and we are always counseling you, saying that we will take the whole process. But in case we get a notification from the government that we are not able to come to the clinic, then we will ask you to stop the treatment right there, and we will always guide you accordingly, like how to take things forward. Of course, knowing very well that this will absolutely not disrupt your hormonal conditions in the body. And when the things becomes better, we can proceed safe and sound with the whole process. So at Orchid Clinic, we have been doing cases successfully, and we are getting amazing success and outcomes. And I wish everybody a safe, life out in this country. Everything is okay. Thank you so much, Cassie.
Thank you, Dr. Partha. If you have any questions that we didn't get to, you're very welcome to send a message to our Instagram account. A lot of you have my personal information. You're welcome to send them to me. I will do my very best to get you the answers and to follow up with you directly. And most importantly, please remember that you do not have to navigate this moment in isolation. Stay in touch with your clinic, reach out for support. We're talking about doing another sort of virtual coffee morning, and then hopefully return to in-person coffee mornings soon. We are all taking this one step at a time. We're all in it together. And thank you so very much for joining us today. Please be safe, be well, everyone, and thank you for your time today.